blood pressure, functional class 3, and low ejection fraction despite maximal medical therapy, no eligible for cardiac resynchronization, and no other for heart transplant. Look the cardiac cath lab, normal coronaries, clean coronaries, in spite of very low ejection fraction. You see here the ejection fraction is 25%. A lady is 42 years old. And look the nuclear medicine. 1 year follow-up went from 25 to 50%. Beautiful. And look the 3-year follow-up, 52%. And look the 4-year follow-up, 60%. Continuous improvement is almost, I cannot say it's completely restored of the ventricular function. It's reversal or improvement. But you see the 4-year follow-up, she's right now in functional class 1, incredible. Another patient, ischemic heart failure, ejection fraction 18%, 68 years old, past medical history of CABG in 2000, is insulin dependent and high blood pressure. The functional class was 4, look, functional class 4, minimal at rest, shortest of breath at rest. The ejection fraction was very low in spite of best medical treatment and also the surgical revascularization. And she was considered no option. Look, the cardiac cath lab, the circ is completely normal, the LAD is occluded, but you will see the graph to the LAD is completely open. You will see here, this is the LAD, the graph to the LAD is completely open, very small LAD, but nothing to do with stent, with angioplasty. And look, the bypass to the right coronary is also open. And so see the nuclear medicine is 18% before the treatment. A 1-year follow-up went to 29%, excellent improvement, also his functional class, her functional class, and look the 4-year follow-ups. Results maintained. She completed the 5-year follow-up, she's still in excellent condition. She didn't need to be rehospitalized for congestive heart failure. Look also the nuclear medicine, the perfusion, you see some inferior defects and some lateral, you see improvement. So maybe this is due to angiogenesis. Another patient with an ejection fraction of 22, has medical history of hypertension in functional class 3. Ejection fraction 22% went to 44, and the 4-year follow-up is 47%. And this is a lateral view of our magical city, Machu Picchu. And this is another patient with 60 years old with delayed cardiomyopathy, ejection fraction 13%. 13% ejection fraction. He was in functional class 4. He was, his weighting was, I think, 280 pounds. So functional class is 4. He was taking the best medical therapy and no donor for heart transplant. This patient was sent from Mexico to my country. You see the improvement of the ejection fraction. The 1-year follow-up went to 28. Look, the 4-year follow-up is 51% ejection fraction. He's in almost functional class. He's in functional class 2. I cannot tell you he's in functional class 1. This lady, I performed, 3 weeks ago we had our 50th international cell therapy, and we used to do some live cases, no? So we did some cases with Dr. Patel, with Dr. Tim Henry from the United States, with a group from Argentina, a group from Brazil. And I performed this case with PRP, with the harvest system, with the same technique. And I will tell you, this patient was in heart transplant list in the United States, so it was impossible to receive the heart transplant due to the problems in lung function. She was excluded. So Dr. Patel sent it to my country to try to receive this treatment. Ejection fraction 13%. So we harvest, was prepared with PRP, rapid system. It takes no more than 14 minutes. The machine ready the cell. So I put the stem cells, and she went back to her country, to Denver, Colorado, 4 days after the procedure. And I will try to read because it's impossible that you read. And you see, we used to receive this kind of work. We used to receive this kind of testimony. Dr. Tuma, Don't forget, ejection fraction 13%. She was waiting heart transplant. To let you know, we have made back to Denver, Colorado yesterday afternoon with no problems, 4 days after the procedure. Some of the milestones were that I couldn't walk, or I could walk all the way to immigration and customs in Houston without having to stop once to get my breath. Even in Denver, where the altitude is 5,000 feet, I walk all the way from the plane to the baggage claim and shuttle without having to stop once to get my breath. Amazing. I'm still in shock, and I feel like each day I awake with more energy. I can climb stairs without gasping for breath. And everyone says my color is really good. I have no words to express how thankful I am for all the work you have done, the doctor, the people that work in my country. Yesterday I talked with Patty Medrum, Dr. Patel, nurse coordinator, on the phone, and she was totally amazed at how well I am doing and how fast I am recovering. I think he will be stupefied. Your staff are doing excellent work. Look this work. If I were skeptical of miracles before, I am totally believe on them. So again, thank you so much and may God continue to be with you and all the marvelous work you are doing. So yesterday I received the 3 weeks evolution, the testimony, because she's going to perform the 2-month follow-up with nuclear medicine and the echo in the United States. I received yesterday this email, 3 weeks after the procedure. Was just going to send you an update when I received your email actually. I have been so extremely busy the past 6 days that I haven't had time to update anyone. I don't have the energy to be busy. Well, her wife, her husband Gary's mother is turning 90 years of age this month, and his entire family showed up in Colorado for an extended rest. In spite of being around food all the weekend, I did not gain any weight. I have lost 4 pounds. This is due to the edema. Since I returned home, I have so much energy to do more amazing. Next week, I am planning to resume my workouts with my personal training at the Cardio Rehab Center. I saw my cardiologist here a week before last, and after listening to my heart and with the stethoscope and taking an EKG, he shook his head in amazing and said that I should not be recovered so fast. So, Dr. Tuma, I rarely have to stop to catch my breath, and I am daily shocked at my recovery rate. I have written to Michael Fox Parkinson Foundation and told them about your work, but that message has vanished in cyberspace. You and your college are working miracles. Thank you so much for giving me a new lease on life, and I awake with a new appreciation of each day. So the conclusion of this study is that this study is the long-term safety and long-term efficacy of this therapy in ischemic and non-ischemic heart failure. This is the first conclusion, it's safe. The therapy is performed with usual cardiac catheterization, it's very easy, takes 15 to 20 minutes to put the cells. Right now the patient are released 4 hours after the procedure. I am doing the procedure with 5 French introducer shifts. It takes, as I told you, no more than 30 minutes. It is associated with significant improvement on symptoms and functional capacity benefits in patients with advanced heart failure. Ejection fraction, this is the conclusion of this study, the 4-year follow-up, increased by 20%. The median ejection fraction improved in 20% in non-ischemic and by 9% to 10% in ischemic cardiomyopathy. Our data suggests that among non-ischemic patients, the left ventricular ejection increment is better even at 4-year follow-up and reveals a high restoration of myocardial dysfunction. The results of this 4-year follow-up demonstrate that the benefit is sustained and without any long-term side effects. So just to show you, this is our